It really seems to take a food cooperative to serve healthy foods. There's just no profits in serving healthy foods in the bulk, especially in the bulk bins, like what I desire, the wheat and barley and oats in the bulk sections without anything else added, no granola, um, anything else like sunflower seeds I could add myself. Um, it really doesn't make much money for the grocery stores. And they don't even want to try, it seems, that maybe even try to jack up the price of the individual food items in the bulk bins. They just don't even bother with it. Okay. And that's the difference between a cooperative and a private owner. A private owner is going to go for the higher profit items. They're going to be more greedy about it. They're just that's the reason they got into the business in the first place, is to make the money. The grocer gets into that kind of business simply for the profits. If they're going to be highly regulated, they're going to hate the job. They're going to hate the work, which should be what is going on with a lot of the individual owners. Is they should be hating their work. They should be heavily regulated. That's what's going on with doctors. We're focusing so much on doctors, they're hating their jobs. They hate this cooperative nature. They hate that there's this mandatory insurance and then the richer people have to pay. They hate that the doctors can't make as much money with with charging people money, and also partly with the drug regulation too. They want to make the money. They want to get rich quick. They want an easy way to make money. Many have taken advantage of it. I mean, it's as clear as day. And this is with health. But I mean, I think it's the wrong focus on to put the blame on the doctors for health. Why should everybody get equal access to doctors, but not equal access to good healthy foods? That's a little more complicated. People just are acting like, yeah, we could regulate our access to doctors, give everybody that free insurance and stuff if you're poor. But what about the health that's leading people to the doctors in the first place? Most of our health is dictated by our diet. It's you are what you eat, and we're still not regulating that. We're only regulating the symptoms. There's a bigger issue with the stuff that people are accessing for food. 80% of the foods in the grocery stores have sugar added to them. It's a drug. People just don't want to recognize sugar as a drug, but that really needs to be regulated. Okay, we don't need to regulate celery or radishes or carrots or whatnot. That's something that the farmers will share. When they have an excess, they'll try to coordinate how much they grow between each other for the grocery store to decide how much they want to sell and all that. What's worse is what a lot of the factories are doing with these food sources and extractions and their extraction process, and creating these ingredient lists that are to be more addictive than what the actual food is. I mean, they're not, these manufacturers aren't replicating the wholesome meal. They're adding like weird chemicals and doing weird extractions that really render the foods unwholesome, and then making them addictive in the grocery stores. They're just like your vacuum cleaner salesman. They don't care. They're in it for the profit. They're gonna try to find the ones that are most addictive and mark those up, and now that the hospitals are free for everyone, why should I care? I could sell whatever I want. People can get even more unhealthy, and they got free access to doctors now. It's a real bad cycle that's going on.